81. A patient is receiving heparin therapy and develops signs of a hemorrhage. What should the nurse do first? A. Administer protamine sulfate as ordered. B. Stop the heparin infusion immediately. C. Notify the physician immediately. D. Monitor the patient's vital signs closely. Answer. B. Stop the heparin infusion immediately. Rationale. Stopping the heparin infusion immediately is the first action to prevent further bleeding, followed by administering antidotes as prescribed and notifying the physician. 82. A patient with a history of alcohol abuse is experiencing tremors and agitation. What is the nurse's first priority? A. Administer sedative medications as prescribed. B. Assess for signs of alcohol withdrawal and provide interventions. C. Encourage the patient to drink water. D. Notify the physician for further orders. Answer. B. Assess for signs of alcohol withdrawal and provide interventions. Rationale. The nurse should assess for alcohol withdrawal symptoms and provide appropriate interventions, such as medications, to prevent seizures or delirium tremens. 83. A patient with a history of deep vein thrombosis, DVT, is experiencing swelling and pain in the affected leg. What is the nurse's priority action? A. Administer pain medication as prescribed. B. Elevate the affected leg and apply warm compresses. C. Measure the circumference of the leg and document changes. D. Notify the physician and prepare for a possible ultrasound. Answer. C. Measure the circumference of the leg and document changes. Rationale. Measuring the leg circumference is essential for monitoring changes in swelling and assessing the severity of the DVT. 84. A patient who has just undergone abdominal surgery is complaining of severe pain. What is the nurse's first priority? A. Administer pain medication as prescribed. B. Assess the patient's incision site for signs of infection. C. Encourage deep breathing and relaxation techniques. D. Reassure the patient that the pain will improve soon. Answer. A. Administer pain medication as prescribed. Rationale. Managing the patient's pain is a priority to improve comfort and facilitate recovery, followed by monitoring for signs of complications. 85. A patient with chronic obstructive pulmonary disease, COPD, is experiencing increased shortness of breath. What should the nurse do first? A. Administer bronchodilators and corticosteroids as prescribed. B. Place the patient in an upright position and administer oxygen. C. Encourage the patient to cough and deep breathe. D. Notify the physician immediately. Answer. B. Place the patient in an upright position and administer oxygen. Rationale. Placing the patient upright and providing oxygen is the priority to improve respiratory function and oxygenation before further treatment. 86. A patient with a history of heart failure is admitted with edema and shortness of breath. What is the nurse's priority action? A. Administer diuretics as ordered. B. Assess lung sounds and oxygen saturation. C. Elevate the patient's legs to reduce swelling. D. Monitor the patient's blood pressure and heart rate. Answer. B. Assess lung sounds and oxygen saturation. Rationale. Assessing lung sounds and oxygen saturation is critical to determine the severity of heart failure and respiratory distress. 87. A patient is receiving intravenous fluids and develops swelling at the foresite. What is the nurse's first action? A. Remove the forecatheter and apply a new one in a different site. B. Notify the physician of the complication. C. Increase the rate of fluid infusion. D. Apply a cold compress to the site to reduce swelling. Answer. A. Remove the forecatheter and apply a new one in a different site. Rationale. The nurse should remove the forecatheter to prevent further complications and apply a new one in a different site if needed. 88. A patient with a history of seizures is admitted with altered mental status. What should the nurse do first? A. Administer antiepileptic medications as ordered. B. Assess the patient's airway, breathing, and circulation. C. Reassure the patient and monitor for seizures. D. Notify the physician immediately. Answer. B. Assess the patient's airway, breathing, and circulation. Rationale. The first priority is ensuring that the patient's airway, breathing, and circulation are intact, especially if they are at risk for seizures. 89. A patient with an indwelling urinary catheter is complaining of bladder discomfort. What is the nurse's priority action? A. Irrigate the catheter with sterile saline. B. Assess the catheter for kinks or blockages. C. Notify the physician for further instructions. D. Administer analgesics as prescribed. Answer. B. Assess the catheter for kinks or blockages. Rationale. The nurse should first assess the catheter for any issues such as kinks or blockages, which could cause discomfort or impede urine flow. 90. A patient with a history of stroke is having difficulty swallowing. What should the nurse do first? A. Offer thickened liquids and soft foods. B. Notify the speech therapist for a swallowing evaluation. C. Provide oral medications in liquid form. D. Encourage the patient to swallow slowly. Answer. B. Notify the speech therapist for a swallowing evaluation. Rationale. A swallowing evaluation by a speech therapist is needed to assess the patient's ability to safely swallow and prevent aspiration. 91. A patient with diabetes is complaining of dizziness, weakness, and a headache. What is the nurse's first priority? A. Administer the prescribed insulin dose. B. Check the patient's blood glucose level. C. Reassure the patient and provide fluids. D. Monitor the patient's vital signs. Answer. B. Check the patient's blood glucose level. Rationale. The symptoms are indicative of a potential hypoglycemic event, so checking the blood glucose level is the priority to determine the cause. 92. A patient who has just undergone a myocardial infarction is being discharged with a prescription for beta blockers. What should the nurse teach the patient about this medication? A. The medication will help lower your blood pressure and heart rate. B. You should take this medication only when you feel chest pain. C. You can stop the medication once you feel better. D. This medication will prevent further bleeding from the heart. Answer. A. The medication will help lower your blood pressure and heart rate. Rationale. Beta blockers are used to lower blood pressure and heart rate, reducing the workload on the heart after a myocardial infarction. 93. A patient is receiving chemotherapy and is complaining of nausea and vomiting. What should the nurse do first? A. Administer antiemetic medication as prescribed. B. Monitor the patient's vital signs and fluid balance. C. Encourage the patient to drink clear fluids. D. Reassure the patient that the symptoms will subside soon. Answer. A. Administer antiemetic medication as prescribed. Rationale. Administering antiemetics is the first step in managing nausea and vomiting related to chemotherapy to provide relief and prevent dehydration. 94. A patient is being prepared for surgery and is receiving preoperative medications. What should the nurse assess first? A. Ensure the patient has signed the informed consent form. B. Assess the patient's vital signs and baseline health status. C. Confirm the surgical procedure and site with the patient. D. Reassure the patient that everything will go smoothly. Answer. B. Assess the patient's vital signs and baseline health status. Rationale. Assessing the patient's vital signs and baseline health status is important before administering medications to ensure they are fit for surgery. 95. A patient with a history of asthma is experiencing an exacerbation. What is the nurse's first priority? A. Administer a bronchodilator as prescribed. B. Administer oxygen therapy to support oxygenation. C. Monitor the patient's peak flow readings. D. Reassure the patient that the symptoms will improve. Answer. A. Administer a bronchodilator as prescribed. Rationale. Administering a bronchodilator is the first step in treating an asthma exacerbation to relieve bronchoconstriction. 96. A patient is recovering from surgery and is complaining of severe pain. What should the nurse do first? A. Administer pain medication as prescribed. B. Assess the surgical site for signs of complications. C. Reassure the patient that pain is expected after surgery. D. Encourage the patient to use relaxation techniques. Answer. A. Administer pain medication as prescribed. Rationale. Administering pain relief as prescribed is the priority to ensure the patient's comfort during the recovery process. 97. A patient with a history of chronic obstructive pulmonary disease, COPD, is complaining of increased shortness of breath. What should the nurse do first? A. Administer bronchodilators as prescribed. B. Encourage the patient to use pursed lip breathing. C. Assess the patient's oxygen saturation levels. D. Place the patient in a supine position to ease breathing. Answer. C. Assess the patient's oxygen saturation levels. Rationale. Assessing oxygen saturation levels helps determine the severity of the respiratory distress and guides further interventions. 98. A patient with a history of heart failure is experiencing difficulty breathing and is becoming cyanotic. What should the nurse do first? A. Administer oxygen therapy, as prescribed. B. Assess the patient's blood pressure and heart rate. C. Notify the physician immediately. D. Reassure the patient that the symptoms will resolve soon. Answer. A. Administer oxygen therapy as prescribed. Rationale. Administering oxygen therapy is the priority to improve oxygenation in a patient with heart failure and respiratory distress. 99. A patient is undergoing a routine physical exam and has an elevated blood pressure reading. What should the nurse do first? A. Reassure the patient and monitor the reading later. B. Encourage the patient to relax and take the reading again. C. Notify the physician of the elevated blood pressure. D. Start treatment for high blood pressure immediately. Answer. B. Encourage the patient to relax and take the reading again. Rationale. Elevated blood pressure readings can sometimes be caused by anxiety or stress, so it is important to retake the reading after the patient has relaxed. 100. A patient is experiencing difficulty breathing and has a history of asthma. What is the first action the nurse should take? A. Administer a bronchodilator as prescribed. B. Place the patient in a high Fowler's position. C. Assess the patient's oxygen saturation levels. D. Call for immediate medical assistance. Answer. A. Administer a bronchodilator as prescribed. Rationale. Administering a bronchodilator is the first action to relieve bronchoconstriction and improve airflow in asthma exacerbations. 101. A patient is receiving morphine for pain control and starts to exhibit signs of respiratory depression. What is the nurse's first priority? A. Administer naloxone as prescribed. B. Increase the oxygen flow rate. C. Assess the patient's vital signs. D. Discontinue the morphine infusion. Answer. A. Administer naloxone as prescribed. Rationale. Naloxone is the antidote for opioid-induced respiratory depression and should be administered immediately in the event of an overdose. 102. A patient is diagnosed with pneumonia and is receiving antibiotic therapy. What is the nurse's primary goal in the care of this patient? A. Promote rest and relaxation. B. Ensure proper hydration. C. Administer antibiotics as prescribed. D. Prevent the spread of infection to others. Answer. C. Administer antibiotics as prescribed. Rationale. Administering antibiotics as prescribed is essential to treat the underlying infection and promote recovery. 103. A patient is receiving continuous enteral feeding through a nasogastric tube. What should the nurse do to prevent aspiration pneumonia? 8. Position the patient in a flat, supine position during feeding. B. Ensure the head of the bed is elevated during and for 30 minutes after feeding. C. Flush the tube with water only after feeding. D. Administer the feeding at a faster rate to prevent discomfort. Answer. B. Ensure the head of the bed is elevated during and for 30 minutes after feeding. Rationale. Elevating the head of the bed reduces the risk of aspiration by promoting proper digestion and preventing reflux. 104. A patient with a history of hypertension is admitted with chest pain. What should the nurse do first? A. Administer nitroglycerin as prescribed. B. Assess the patient's blood pressure and heart rate. C. Reassure the patient that it is a mild condition. D. Notify the physician of the chest pain. Answer. B. Assess the patient's blood pressure and heart rate. Rationale. Assessing blood pressure and heart rate is the priority to identify any cardiovascular issues that may be contributing to the chest pain. 105. A patient with a history of diabetes is experiencing low blood sugar, hypoglycemia. What should the nurse do first? A. Administer insulin as prescribed. B. Administer a glucose source, such as orange juice or glucose tabs. C. Notify the physician. D. Reassure the patient that the symptoms will resolve soon. Answer. B. Administer a glucose source, such as orange juice or glucose tabs. Rationale. Hypoglycemia requires immediate treatment with glucose to raise blood sugar levels and prevent complications. 106. A patient is receiving antibiotics and develops diarrhea. What should the nurse do first? A. Discontinue the antibiotics immediately. B. Assess the stool for signs of Clostridium difficile infection. C. Increase the patient's fluid intake. D. Notify the physician about the diarrhea. Answer. B. Assess the stool for signs of Clostridium difficile infection. Rationale. Diarrhea can be a sign of C. difficile infection, which requires specific treatment, so the nurse should assess the stool to identify this condition. 107. A patient with congestive heart failure is experiencing shortness of breath, fatigue, and edema. What is the nurse's priority action? A. Administer diuretics as prescribed. B. Assess lung sounds for crackles and fluid buildup. C. Increase the patient's oxygen supply. D. Encourage the patient to ambulate. Answer. B. Assess lung sounds for crackles and fluid buildup. Rationale. Assessing lung sounds for crackles helps to determine the extent of fluid retention and guides further interventions, such as diuretics or oxygen therapy. 108. A patient with chronic kidney disease is receiving hemodialysis. What should the nurse assess before initiating dialysis? A. Serum potassium level. B. Oxygen saturation. C. Blood pressure. D. Serum calcium level. Answer. A. Serum potassium level. Rationale. High potassium levels can be life-threatening and need to be corrected before dialysis. The nurse should assess potassium levels to prevent complications. 109. A patient with a history of asthma is admitted with wheezing and difficulty breathing. What should the nurse do first? A. Administer oxygen therapy as prescribed. B. Administer a bronchodilator as prescribed. C. Monitor the patient's respiratory rate and pulse. D. Call for respiratory therapy consult. Answer. B. Administer a bronchodilator as prescribed. Rationale. Bronchodilators are the first line of treatment to open airways and relieve bronchospasm during an asthma exacerbation. 110. A patient is recovering from surgery and is complaining of nausea and vomiting. What should the nurse do first? A. Administer antiemetic medication as prescribed. B. Assess the patient's vital signs and fluid balance. C. Encourage the patient to drink clear fluids. D. Reassure the patient that the symptoms will subside soon. Answer. A. Administer antiemetic medication as prescribed. Rationale. Administering antiemetics will alleviate nausea and vomiting, improve patient comfort, and prevent complications like dehydration. 111. A patient with a history of deep vein thrombosis, DVT, is being treated with warfarin. What should the nurse assess regularly? A. Serum potassium levels. B. International normalized ratio, INR. C. Oxygen saturation. D. Serum sodium levels. Answer. B. International normalized ratio, INR. Rationale. Warfarin therapy requires regular monitoring of INR to ensure the patient's blood is adequately anticoagulated and to prevent bleeding complications. 112. A patient is receiving a blood transfusion and develops fever and chills. What should the nurse do first? A. Stop the transfusion immediately. B. Administer acetaminophen for fever. C. Notify the physician immediately. D. Check the patient's vital signs. Answer. A. Stop the transfusion immediately. Rationale. The nurse should stop the transfusion immediately to prevent further reactions and then assess the patient's condition and notify the physician. 113. A patient with a history of hypertension is prescribed an antihypertensive medication. What should the nurse teach the patient about this medication? A. You can stop the medication once your blood pressure is normal. B. The medication will prevent the development of heart failure. C. Take the medication at the same time each day. D. The medication will cure your hypertension. Answer. C. Take the medication at the same time each day. Rationale. Taking antihypertensive medication consistently at the same time each day helps to maintain a stable blood pressure and optimize treatment effectiveness. 114. A patient is admitted with a diagnosis of acute pancreatitis. What is the nurse's priority in managing this patient? A. Administer pain medication as prescribed. B. Monitor vital signs and fluid status closely. C. Restrict oral intake to prevent further irritation. D. Provide emotional support for the patient. Answer: C. Restrict oral intake to prevent further irritation. Rationale: restricting oral intake helps reduce the workload on the pancreas and promotes healing in acute pancreatitis. 115. A patient with a history of hypertension is complaining of a severe headache. What is the nurse's first priority? A. Administer pain medication as prescribed. B. Assess the patient's blood pressure. C. Place the patient in a dark, quiet room. D. Notify the physician immediately. Answer: B. Assess the patient's blood pressure. Rationale: a severe headache can be a sign of elevated blood pressure, so assessing it is the priority to guide further interventions. 116. A patient is receiving intravenous fluids and develops signs of infiltration. What should the nurse do first? A. Discontinue the fore and restart it in another site. B. Apply a warm compress to the infiltrated site. C. Increase the fore infusion rate to flush the area. D. Notify the physician of the infiltration. Answer: A. Discontinue the fore and restart it in another site. Rationale: infiltration occurs when fore fluid enters the tissue rather than the vein, so the fore should be discontinued and restarted in a different site. 117. A patient with a history of renal failure is receiving dialysis. What should the nurse assess before initiating dialysis? A. Serum potassium levels. B. Respiratory rate and depth. C. Serum calcium levels. D. Blood pressure and heart rate. Answer: D. Blood pressure and heart rate. Rationale: assessing blood pressure and heart rate is important to ensure that the patient can tolerate dialysis and prevent complications like hypotension. 118. A patient is receiving chemotherapy and is at risk for neutropenia. What should the nurse monitor closely? A. Blood glucose levels. B. Platelet count. C. White blood cell count. D. Serum calcium levels. Answer: C. White blood cell count. Rationale: neutropenia is characterized by low white blood cell counts, which increases the risk of infection, so monitoring is crucial. 119. A patient is recovering from a stroke and has difficulty swallowing. What is the nurse's first priority? A. Encourage the patient to drink thickened liquids. B. Notify the speech therapist for a swallowing evaluation. C. Offer the patient small, frequent meals. D. Monitor the patient's oxygen saturation levels. Answer: B. Notify the speech therapist for a swallowing evaluation. Rationale: a speech therapist should assess the patient's swallowing ability to prevent aspiration and guide safe feeding strategies. 120. A patient has been diagnosed with hyperthyroidism. What should the nurse monitor closely? A. Serum glucose levels. B. Blood pressure and heart rate. C. Serum potassium levels. D. Oxygen saturation levels. Answer: B. Blood pressure and heart rate. Rationale: hyperthyroidism can lead to tachycardia and hypertension, so monitoring these parameters is essential for managing the patient's condition. 121. A patient with a history of chronic obstructive pulmonary disease, COPD, is admitted with increased shortness of breath. What is the nurse's first action? A. Administer oxygen therapy. B. Position the patient in a high Fowler's position. C. Administer a bronchodilator as prescribed. D. Notify the physician. Answer: C. Administer a bronchodilator as prescribed. Rationale: a bronchodilator is the first-line treatment for alleviating airway obstruction and improving breathing in COPD exacerbation. 122. A patient is receiving warfarin therapy. What is the nurse's priority action before administering the next dose? A. Check the patient's INR levels. B. Assess the patient's blood pressure. C. Evaluate for signs of bleeding. D. Administer vitamin K if needed. Answer: A. Check the patient's INR levels. Rationale: the INR level must be monitored regularly to ensure the patient's blood is adequately anticoagulated and to prevent bleeding complications. 123. A patient with a history of stroke is experiencing difficulty speaking. What should the nurse do first? A. Call for a speech therapy consult. B. Assess the patient's airway and breathing. C. Encourage the patient to practice speaking. D. Notify the physician. Answer: B. Assess the patient's airway and breathing. Rationale: ensuring that the patient has a clear airway and is breathing properly is the priority in case of a stroke, as it may affect both. 124. A patient is admitted with dehydration. What is the nurse's priority action? A. Administer intravenous fluids as prescribed. B. Monitor the patient's vital signs. C. Obtain a urine sample for analysis. D. Encourage oral fluid intake. Answer: A. Administer intravenous fluids as prescribed. Rationale: dehydration can cause serious complications, so administering fluids is the primary intervention to restore the patient's fluid balance. 125. A patient with a history of diabetes is experiencing blurred vision, dizziness, and tremors. What should the nurse do first? A. Administer glucose to correct hypoglycemia. B. Administer insulin as prescribed. C. Monitor the patient's blood sugar level. D. Notify the physician. Answer: A. Administer glucose to correct hypoglycemia. Rationale: symptoms of hypoglycemia such as blurred vision, dizziness, and tremors should be treated immediately with glucose. 126. A patient is being treated with an anticoagulant. What should the nurse assess regularly to detect complications? A. Serum calcium levels. B. Signs of bleeding. C. Oxygen saturation levels. D. Serum glucose levels. Answer: B. Signs of bleeding. Rationale: anticoagulants increase the risk of bleeding, so the nurse must monitor for signs such as bruising, bleeding gums, or blood in urine or stool. 127. A patient with a history of gastrointestinal reflux disease, GERD, is experiencing heartburn. What should the nurse recommend? A. Elevate the head of the bed during sleep. B. Drink large amounts of water. C. Eat small meals throughout the day. D. Avoid lying down after meals. Answer: D. Avoid lying down after meals. Rationale: lying down after meals can exacerbate GERD symptoms by allowing stomach acid to flow back into the esophagus. 128. A patient has been prescribed a potassium-sparing diuretic. What is the nurse's priority consideration? A. Monitor the patient's blood pressure regularly. B. Monitor the patient's potassium levels. C. Assess the patient's weight daily. D. Ensure that the patient avoids high-sodium foods. Answer: B. Monitor the patient's potassium levels. Rationale: potassium-sparing diuretics can cause elevated potassium levels, which can lead to life-threatening hyperkalemia. 129. A patient who has just undergone abdominal surgery is complaining of pain. What is the nurse's priority action? A. Assess the patient's pain level using a pain scale. B. Administer prescribed pain medication. C. Reassure the patient that pain is expected. D. Encourage deep breathing exercises. Answer: A. Assess the patient's pain level using a pain scale. Rationale: the nurse must assess the pain level first to determine if the prescribed pain medication is effective or if additional interventions are needed. 130. A patient is scheduled for a colonoscopy. What should the nurse instruct the patient to do the day before the procedure? A. Eat a light meal and avoid solid foods. B. Drink plenty of fluids and avoid high-fiber foods. C. Take a laxative as prescribed to clear the bowels. D. Increase the intake of dairy products. Answer: C. Take a laxative as prescribed to clear the bowels. Rationale: a clear bowel is essential for a successful colonoscopy, and taking the prescribed laxative helps to cleanse the intestines. 131. A patient is experiencing chest pain and shortness of breath. What should the nurse do first? A. Administer oxygen as prescribed. B. Assess the patient's vital signs. C. Administer aspirin as prescribed. D. Notify the physician immediately. Answer: A. Administer oxygen as prescribed. Rationale: administering oxygen improves oxygenation to the heart muscle, helping reduce the workload on the heart and potentially preventing further damage. 132. A patient with a history of seizures is being treated with antiepileptic drugs. What should the nurse assess regularly? A. Blood glucose levels. B. Renal function. C. Serum drug levels. D. Hemoglobin levels. Answer: C. Serum drug levels. Rationale: regular monitoring of serum drug levels is important to ensure therapeutic levels of antiepileptic drugs and prevent toxicity or inadequate treatment. 133. A patient is receiving chemotherapy and is at risk for infection. What should the nurse do to reduce this risk? A. Ensure that the patient receives an adequate fluid intake. B. Perform strict hand hygiene before patient contact. C. Administer prophylactic antibiotics as prescribed. D. Avoid any invasive procedures unless absolutely necessary. Answer: B. Perform strict hand hygiene before patient contact. Rationale: hand hygiene is the most effective way to prevent the spread of infections, especially in immunocompromised patients. 134. A patient with a history of hypertension is experiencing a sudden, severe headache. What is the nurse's first action? A. Assess the patient's blood pressure. B. Administer pain medication. C. Place the patient in a quiet, dark room. D. Notify the physician immediately. Answer: A. Assess the patient's blood pressure. Rationale: a sudden, severe headache may indicate a hypertensive crisis, which requires immediate blood pressure assessment and management. 135. A patient is receiving 4 antibiotics and develops a rash. What should the nurse do first? A. Discontinue the antibiotic and notify the physician. B. Apply an antihistamine ointment. C. Administer pain relief medication. D. Monitor the patient's vital signs. Answer: A. Discontinue the antibiotic and notify the physician. Rationale: a rash may indicate an allergic reaction to the antibiotic, and the first action is to stop the medication and notify the physician. 136. A patient is receiving insulin therapy. What should the nurse teach the patient to avoid hypoglycemia? A. Inject insulin immediately after meals. B. Skip meals if feeling nauseous. C. Eat a small snack between meals. D. Perform intense exercise without eating first. Answer: C. Eat a small snack between meals. Rationale: eating small snacks helps maintain blood sugar levels and prevent hypoglycemia, especially in patients receiving insulin. 137. A patient is admitted with an acute myocardial infarction. What should the nurse monitor closely? A. Serum glucose levels. B. Serum potassium levels. C. Heart rate and rhythm. D. Oxygen saturation levels. Answer: C. Heart rate and rhythm. Rationale: monitoring the heart rate and rhythm is critical in managing myocardial infarction, as arrhythmias can lead to serious complications. 138. A patient is receiving pain medication following surgery. What should the nurse monitor for in relation to opioid use? A. Respiratory depression. B. Hypotension. C. Tachycardia. D. Urinary retention. Answer: A. Respiratory depression. Rationale: opioid medications can cause respiratory depression, which can be life-threatening, so the nurse should monitor for this effect. 139. A patient is diagnosed with heart failure. What should the nurse prioritize in the care of this patient? A. Administer diuretics as prescribed. B. Promote increased fluid intake. C. Encourage prolonged rest. D. Elevate the head of the bed for comfort. Answer: A. Administer diuretics as prescribed. Rationale: diuretics are used to reduce fluid overload in heart failure, alleviating symptoms like shortness of breath and edema. 140. A patient with diabetes is receiving insulin and complains of feeling faint and weak. What should the nurse do first? A. Assess the patient's blood sugar level. B. Administer a dose of insulin. C. Offer the patient a snack with carbohydrates. D. Monitor the patient's vital signs. Answer: A. Assess the patient's blood sugar level. Rationale: the first priority is to assess blood sugar levels to determine if hypoglycemia is the cause of the symptoms. 141. A patient with asthma is admitted with increased wheezing and shortness of breath. What is the nurse's first action? A. Administer a short-acting beta-agonist, SABA, inhaler. B. Assess the patient's oxygen saturation level. C. Provide supplemental oxygen. D. Notify the physician. Answer: A. Administer a short-acting beta-agonist, SABA, inhaler. Rationale. A SABA inhaler is the first-line treatment to relieve acute bronchospasm and asthma. 142. A nurse is caring for a patient who has just undergone a lumbar puncture. What is the most important post-procedure care? A. Encourage the patient to drink plenty of fluids. B. Keep the patient flat in bed for several hours. C. To perform neurological assessments every hour. D. Monitor the patient's blood pressure every 30 minutes. Answer. B. Keep the patient flat in bed for several hours. Rationale. Keeping the patient flat helps prevent post-lumbar puncture headaches caused by cerebrospinal fluid leakage. 143. A patient with a history of stroke is exhibiting signs of dysphagia. What should the nurse do first? A. Notify the physician immediately. B. Assess the patient's ability to swallow small sips of water. C. Place the patient on a pureed diet. D. Refer the patient for a speech therapy evaluation. Answer. B. Assess the patient's ability to swallow small sips of water. Rationale. Before taking further action, the nurse must assess swallowing ability to determine the extent of the problem. 144. A patient who is receiving chemotherapy develops a temperature of 101 degrees Fahrenheit 38.3 degrees Celsius. What is the nurse's priority action? A. Administer acetaminophen to reduce fever. B. Obtain blood cultures and notify the physician. C. Monitor the patient's vital signs every 15 minutes. D. Encourage the patient to drink fluids. Answer. B. Obtain blood cultures and notify the physician. Rationale. Fever in a chemotherapy patient may indicate infection, requiring blood cultures and immediate notification of the physician. 145. A patient is receiving furosemide for edema. What should the nurse monitor to prevent complications? A. Blood pressure. B. Potassium levels. C. Urine output. D. Respiratory rate. Answer. B. Potassium levels. Rationale. Furosemide is a loop diuretic that can lead to hypokalemia, so potassium levels must be closely monitored. 146. A patient is receiving morphine for pain management. What is the nurse's priority assessment? A. Respiratory rate. B. Heart rate. C. Blood pressure. D. Pain level. Answer. A. Respiratory rate. Rationale. Morphine can cause respiratory depression, so monitoring the respiratory rate is the priority to prevent hypoventilation. 147. A patient is diagnosed with type 2 diabetes. What is the most important teaching point for this patient? A. Monitor blood glucose levels regularly. B. Take insulin injections daily. C. Limit fluid intake to prevent hyperglycemia. D. Eat small meals but avoid carbohydrates. Answer. A. Monitor blood glucose levels regularly. Rationale. Regular monitoring of blood glucose is critical for managing type 2 diabetes, as it helps the patient adjust treatment and prevent complications. 148. A nurse is caring for a patient with an indwelling urinary catheter. What is the most important intervention to prevent infection? A. Change the catheter bag every 24 hours. B. Encourage the patient to drink fluids. C. Ensure the catheter is positioned below the level of the bladder. D. Clean the catheter insertion site with alcohol. Answer. C. Ensure the catheter is positioned below the level of the bladder. Rationale. Keeping the catheter below the bladder prevents urine from flowing back into the bladder, which can lead to infection. 149. A patient with heart failure is experiencing increased shortness of breath and edema. What is the nurse's priority intervention? A. Administer oxygen therapy. B. Administer a diuretic as prescribed. C. Elevate the patient's legs to reduce edema. D. Provide a high-salt diet. Answer. B. Administer a diuretic as prescribed. Rationale. Diuretics help reduce fluid overload, which can relieve symptoms of shortness of breath and edema in heart failure. 150. A patient with a history of alcohol abuse is admitted with jaundice and ascites. What condition should the nurse be most concerned about? A. Hepatitis B. B. Cirrhosis. C. Pancreatitis. D. Gallstones. Answer. B. Cirrhosis. Rationale. Chronic alcohol abuse can lead to liver cirrhosis, which is associated with jaundice and ascites. 151. A patient is experiencing a panic attack. What is the nurse's first action? A. Encourage slow, deep breathing. B. Administer prescribed anti-anxiety medication. C. Offer water to calm the patient. D. Ensure the patient is in a quiet, dark room. Answer. A. Encourage slow, deep breathing. Rationale. Deep breathing helps activate the parasympathetic nervous system and can reduce the symptoms of a panic attack. 152. A patient with a chest tube is showing signs of respiratory distress. What is the nurse's priority action? A. Check the tubing for kinks or obstructions. B. Administer supplemental oxygen. C. Notify the physician immediately. D. Reposition the patient to improve lung expansion. Answer. A. Check the tubing for kinks or obstructions. Rationale. A kink or obstruction in the chest tube can cause respiratory distress, so checking the tubing is a priority action. 153. A nurse is caring for a patient with a burn injury. What is the most important intervention in the first 24 hours after the burn? A. Administer analgesics to manage pain. B. Apply topical antibiotics to the burn. C. Maintain fluid resuscitation to prevent shock. D. Elevate the affected areas to reduce swelling. Answer. C. Maintain fluid resuscitation to prevent shock. Rationale. The priority in the first 24 hours after a burn injury is to maintain fluid resuscitation to prevent hypovolemic shock. 154. A patient with a history of asthma is experiencing an acute attack. What is the nurse's first action? A. Administer a short-acting beta-agonist (SABA) inhaler. B. Administer oxygen therapy. C. Assess lung sounds. D. Notify the physician immediately. Answer. A. Administer a short-acting beta-agonist (SABA) inhaler. Rationale. A SABA inhaler is the most effective treatment to relieve bronchospasm during an asthma attack. 155. A nurse is caring for a patient with a fresh surgical wound. What is the most important intervention to prevent infection? A. Change the dressing every 12 hours. B. Wash hands before and after handling the wound. C. Encourage the patient to eat a high-protein diet. D. Apply an antimicrobial ointment to the wound. Answer. B. Wash hands before and after handling the wound. Rationale. Proper hand hygiene is essential in preventing infection when caring for a surgical wound. 156. A patient is receiving chemotherapy and reports feeling nauseous. What should the nurse do first? A. Administer an antiemetic as prescribed. B. Offer the patient ginger tea. C. Encourage the patient to eat small, frequent meals. D. Assess the patient's vital signs. Answer. A. Administer an antiemetic as prescribed. Rationale. Administering an antiemetic is the first-line intervention to relieve nausea in chemotherapy patients. 157. A patient with a history of peptic ulcer disease is prescribed NSAIDs. What should the nurse teach the patient about potential side effects? A. NSAIDs can cause stomach irritation and bleeding. B. NSAIDs can increase blood pressure. C. NSAIDs can cause constipation. D. NSAIDs can lead to kidney damage. Answer. A. NSAIDs can cause stomach irritation and bleeding. Rationale. NSAIDs are known to irritate the stomach lining and increase the risk of gastrointestinal bleeding, especially in patients with peptic ulcers. 158. A patient with a history of deep vein thrombosis, DVT, is being discharged on anticoagulant therapy. What is the most important instruction for the nurse to provide? A. Limit physical activity to prevent further clots. B. Take the medication at the same time every day. C. Avoid foods high in vitamin K. D. Wear compression stockings to prevent swelling. Answer. B. Take the medication at the same time every day. Rationale. Consistency in taking anticoagulants is essential for maintaining therapeutic levels and preventing complications. 159. A patient with chronic obstructive pulmonary disease, COPD, is admitted with an exacerbation. What is the nurse's priority action? A. Administer a bronchodilator as prescribed. B. Provide oxygen therapy to maintain SpO2 levels. C. Assess the patient's vital signs. D. Administer corticosteroids as prescribed. Answer. B. Provide oxygen therapy to maintain SpO2 levels. Rationale. Oxygen therapy is a priority in COPD exacerbations to maintain adequate oxygenation and prevent respiratory failure. 160. A nurse is caring for a patient with a new diagnosis of diabetes. What is the most important aspect of patient education? A. Teach the patient how to monitor blood glucose levels. B. Discuss the importance of avoiding sugary foods. C. Instruct the patient on insulin administration. D. Teach the patient to check for urine ketones. Answer. A. Teach the patient how to monitor blood glucose levels. Rationale. Monitoring blood glucose is essential for managing diabetes and adjusting treatment as necessary.